Hello, this is Dr. VanderWel, and from all of us at Aviva, congratulations on having your surgery scheduled. We're really excited for you. I put together this video to help you get prepared for surgery and help you get through that first week of surgery as smoothly as we possibly can. We're going to review hydration, activity, and diet. The first thing is make sure that you have a pad of paper and a pen so that you can write down the important stuff and also any questions you have so we can review them in your pre-op visit. So if you don't have those, hit the pause button. We'll be right back. All right, here we go. So it's important to be hydrated after surgery. Your body is a large chemical reaction. 60% of it is water. It's important to make sure that we're keeping those appropriate levels of that. The best way to stay hydrated after surgery is to take small sips at a regular interval. Your stomach goes from this large bag down to a small tube. Is extra small because there's some swelling and there's some spasms. And so there's just not a lot of space. So you got to drink small amounts at lots of frequent intervals. The best way to get ready for this is to practice. Drink about for 1 hour every day on the run up to surgery. I want you to, if you're sitting, make sure your back is straight, 2 feet on the floor, or you can be standing, where you drink about 1 ounce, set the timer on your phone for 10 minutes. 1 ounce, 10 minutes, 1 ounce, 10 minutes. That is the best rhythm I know to help you stay hydrated for when you're recovering from surgery. When you're awake, you're doing that pattern. This is really boring. It's kind of obvious, obviously. And it's a little tedious, but it is a really important for developing some kind of, some muscle memory so that this is sort of on autopilot after surgery when you're not feeling super good and you're kind of out of it from anesthesia. You don't want that to be the first time you've ever practiced this. The next thing to help you get ready and strong for surgery is to be doing some strenuous exercise. And I know this is a challenge for a lot of people, but I want you to do your best at getting your body out of its comfort level. So doing something for about 3 times for about 30 a week, about 30 minutes each time, where your heart rate's going fast, you're breathing hard, you're like, man, this is not very fun. I want to quit. Or why am I doing this again? Curse you, Dr. VanderWel. That is the goal. Is that you were kind of pushing your body to the limit so that we're getting it tuned up. Your heart is getting tuned up. Your lungs are getting tuned up. Your circulatory system is getting tuned up. You start using some of those natural endorphins, which are natural pain medication. Putting the work in here really helps. Surgery won't be as complicated. It won't be as hard on your body as some of this stuff will be. And I just want you to get through surgery as smoothly as possible. So doing your best on this does help you get through surgery smoother. Next important thing to work on the run up to surgery is your pre-op diet. You'll go over this with your nutritionist. This is a high protein, low carb diet. The goal is that we get you losing a little bit of weight into surgery. And where that weight's coming from is that it's shrinking down your liver and it's shrinking the fat that's around your intestines so that we have more space to do a better and safer surgery. I like you to work on small portion sizes during this time, about 5 to 6 small meals a day of about 1 cup size. This is a big shift for a lot of people of moving from I kind of eat until I feel full to a contentment at a small portion, strategy of eating. And that is a big shift for a lot of people, and it is challenging, and you will probably fail a lot at this, which is okay. Do your best. Just kind of keep going down that journey, keep working on that, and this is going to help, with after surgery, this will be pretty different. So the other thing I like you to try to do is work on practicing tracking your food in an app. We recommend the MyFitnessPal and Berrytastic apps. They're great. There are lots of other great tracking apps to track how much calories you're taking in, how much protein, how much carbs. That way, that skill is really important for knowing where we're at and what we're working with. So that's how you kind of get ready for surgery. After surgery, it's a pretty different story for a lot of these things. The hydration is really important. It's putting that work in ahead of time really helps us pay off now. So you're going to be taking a small sip every 10 minutes. Sip, 10 minutes, sip, 10 minutes. You're going to start about ½ an ounce. When ½ an ounce is easy, I want you to move up to 1 ounce. And when 1 ounce is easy, start moving your way towards 2 ounces. Once you get to 2 ounces, try not to go past that because your stomach is not very big on the inside and you don't want to put too much stress on that while it's healing. So, just keep doing your best, and when this stuff's easy, keep that progression going. From an activity standpoint, I want you to make sure that you are walking a little bit every hour, and this is completely different than what we were talking about before surgery. The goal of this is that you are doing small, frequent amounts, and then we're not pushing our bodies to limits. We're not trying to get a bunch of steps in here. we're really just trying to make sure we don't get blood clots in our legs, and we're trying to make sure that our digestive tract helps our digestive tract move everything through and keeps your lungs nice and open. So I want you every hour, get up and move to your kitchen, down the hallway, to the porch, eventually to the mailbox. In that first week, you just walk in and you're just going a little bit further each time. After a week, we will increase your activity level as long as you're hitting your hydration goals and your protein's doing well and you're feeling good. So your diet goes to a liquid diet in that first week after surgery. Start with clear liquids, so water, protein water, broth, Gatorade Zero, all good things. Start at half an ounce at first. Make sure that when that's going okay, you progress to an ounce. Eventually progress to 2 ounces. Once you're doing the clears, once clears are going okay, you can start moving to full liquids. Sometimes it helps with the full liquids. They can feel a little thick. You can just dilute them with a little bit of water or broth or something like that to really help, kind of blur that transition and make it just a little bit smoother. It's great to be measuring your portion size at this point, know what you're working with. And also, I really encourage you to track. Tracking it's hard for some people, and it's not very a natural thing, but it will never get easier than this week. So if you can put a little bit of work into tracking, it helps you really start building a little bit of confidence with that skill and a little more familiarity. So, all right, those are our tips and tricks for helping you get through and prepared for surgery, and really excited for you. You're going to do great, and looking forward to see you at your pre-op visit.